how hospitals in Mumbai are dealing with asymptomatic COVID-19 patients. Now, this is a huge worry because nurses and doctors could get infected from asymptomatic patients who don't have either known travel history or contact with COVID-19 patients. With over 1,000 cases, 1,100 cases now in Maharashtra, or 1,200, pardon me, and more than 700 of them in Mumbai alone, asymptomatic cases are the biggest worry for health practitioners. Take a look.
Healthcare workers who are battling the COVID-19 pandemic are now worried about asymptomatic patients, those who are admitted for other illnesses and do not show any symptoms of COVID-19. What do they do with them? And this is now a scenario that is being taken into consideration in the battle against infections of the novel coronavirus. Jaslok Hospital, one of Mumbai's premier healthcare centers, had to shut OPD and new admissions after an asymptomatic patient tested positive for COVID-19, putting the hospital under stress as over 1,000 staff members, including doctors and nurses, had to be isolated and tested. 21 nurses and paramedic staff tested positive for COVID-19 after coming into contact with a patient who was admitted for a heart ailment. The hospital says this is an unprecedented situation and it will now reopen on the 13th of this month.
2 weeks back, we had a situation where a non-COVID patient admitted on 11th of March without any travel history or symptoms was tested COVID positive. So we had to trace all the connected employees, nurses and doctors. Few were found COVID positive of them, and we had to then widen the scope of tracing and testing. So far in last 10 days, we have tested over 1,000 employees, including nurses and doctors. We believe that this was the best method to deploy to ensure that it is safe to start again.
The communicability of COVID-19 infection is a challenge for healthcare workers. And at Wokhad Hospital, another big hospital in Mumbai, the situation is much worse. The municipal authorities have declared the hospital a containment zone as it has a huge cluster of patients, over 50, with at least 40 nurses and 3 doctors infected. A 70-year-old man who was admitted to the ICU tested positive and he later spread the disease to nurses who attended to him. According to the hospital, the source of the infection was identified as a 70-year-old patient who was admitted to the hospital on 17th March for a cardiac emergency. The patient was asymptomatic. On March 26, the patient developed cough and was tested for COVID-19, which turned out positive, the hospital added. The hospital clarified that staff were unknowingly exposed to the infection in the time period, and it is informing the healthcare sector at large not to be misled by asymptomatic patients. According to a Maharashtra government report released on 6th April, based on data from a day earlier, of the 16,008 tested people, only 4% or 635 were positive cases of COVID-19. 14,837 people tested negative and the results of 532 were awaited. But then comes the worrying part. Amongst those who tested positive, 478 or 75% were asymptomatic patients. Some of them with no travel history or known COVID-19 positive contacts either, making it difficult for hospitals to segregate them. And this is what the healthcare sector now has to grapple with as the number of positive cases continue to rise. While the problem has been most severe at Wokhad Hospital, it's a wake-up call for other healthcare institutions as well. The question is finding a solution that does not deny patients treatment, but at the same time keeps everyone else safe by stopping the spread of the coronavirus. In Mumbai, with camera person Rajendra Dhayalkar, Saurabh Gupta, NDTV.